Yes, sir, we can start now. We're live on Facebook as well.
Thank you very much, Krishna, for inviting me. A quick introduction. My name is Dr. Charit. I am a consultant cardiologist based in Bangalore, Vikram Hospital. And today I am here to speak to you on World Heart Day about one very important disease, which is high blood pressure. And as my colleague and very close friend Ajit has very beautifully framed this topic, that it is a ticking time bomb. And there is a reason why that is so. So before we start off, I want to give you a quick introduction about what is blood pressure. Is that if your blood pressure is 140 or 90 or above on 2 different days on an outpatient basis, you are considered a hypertension. Now, what is blood pressure? Is that blood pressure is the force in which the heart is producing or pumping, that is pushing the blood out to the rest of the body. And this is the force which is also on the walls of the artery. So higher the force that is there, the more pressure which is there on the walls or the artery walls, and this leads to damage. Now, the problem with hypertension, that it is a silent killer, and most people do not know that they have hypertension. So how big is this problem? Well, 1.1 billion people have hypertension in this world, and I believe India will be one of the largest populations with hypertension. 1 in 4 men and 1 in 5 women will have blood pressure. There have been multiple studies in India, some of them in urban India, in metros. They have found that 40% of everybody who they randomly sampled were found to have increased blood pressure. So you can understand that this is a problem which is very, very large in our country. Now, what are the risk factors for hypertension? The first is of course diet and salt. Now, the Indian food contains the maximum amount of salt, and it could be pickle, it could be papad, it could be sandige. All of these, and including the food that we use, salt is one of the biggest reasons for hypertension. And let me tell you this, is that the body does not need this salt which we add in cooking. In the fruits and vegetables, there is enough of sodium that is extracted by the body for all our needs. The salt that we add in this cooking is only for taste, and this of course increases the blood pressure. It is found that those people who have less fruits and vegetables are more likely to have blood pressure. And there's a very clear correlation between fruits and vegetables, blood pressure, and heart disease. And when I say fruits and vegetables, I mean at least 2 separate fruits, not just bananas. So that is a very important aspect. Saturated fatty acids and trans fatty acids, this is usually in all our junk food, in our chips, in the bakery items, have a lot of trans fatty acids, especially the deep fried items, which are the pot is boiling and it goes on boiling and the oil gets reused, and every time you are reusing the oil, you are increasing these trans fatty acids, and those are far worse for heart disease and blood pressure. Now, the fourth one, which is being overweight, this is 100% on the increase in India, right? Everybody these days have a small belly, and that 100% causes blood pressure. Excess of alcohol drinking causes blood pressure, increase in blood pressure. This is very, very well known, which is why one of the important reasons are tobacco and alcohol. If you cut down that, you'll reduce your blood pressure by at least 10 millimeters of mercury. Lack of physical activity, and when I say physical activity, I mean at least walking a couple of days a week for 30 minutes is very important to prevent blood pressure. Now, What are, because the blood pressure is high in the body, and I said it causes vascular damage, andre damage to the blood vessels that are not only in the heart but to go to the brain, to the kidney, in the eyes, and other complications. What are the side effects of this? Of course, in the heart it causes heart attacks, it causes stroke, it causes kidney failure, it causes blindness, and multiple other complications. So, the single most important way that you can avoid all of these diseases is to make sure that your blood pressure is under control. Now, I'll tell you how it is. For instance, here is a picture of the heart, and here you can see where my mouse is moving over here. This is the muscle of the heart, and inside this is where the cavities are. These are the valves of the heart. Now what happens if you have blood pressure? You can see the same thick muscle has become so much thicker, and the thicker the muscle means that more blood pressure is there. Blood pressure is uncontrolled, and this is a very important aspect in terms of diseases. So higher the blood pressure, uh, thicker the heart muscle, this is a bad indicator. So when you get an echo done, especially as a part of your health checkup, if you find that there's left ventricular hypertrophy, that means the heart being very thick, it is not a good sign for the heart. So what about the kidneys? And here you can see on the left side is the normal kidneys, and how the simple thin walled structures are there, very complicated thin wall structures. Now with hypertension and hypertensive heart disease, these start to become obliterate. As you can see, obliterate, and they just become thick, fibrosed, and they stopped working, which is why when you have elevated blood pressure, you will have kidney failure, and a biopsy will very clearly show the reason for this. Now, hypertension is also one of the most important causes of preventable blindness. And what does that mean? Here is a beautiful example of how the retina, so when you shine a light into our eyes and see the blood vessels of the heart, we can see that they are very beautiful, very thin, very delicate. Now what happens is that, as I told you, that with blood pressure, these vessels become very thick, and they become thick, they start to become narrower, and they start to have bleeding in multiple spots, and you have a loss of your vision. So as you grow older, one of the important reasons for loss of vision is, of course, bad hypertensive retinopathy, which is why you need to make sure that people with blood pressure also get their fundus examination, which gives you a very clear indication. If the blood vessels that you can see are damaged, which means there will be damage inside the heart, inside the brain, inside the kidney. So make sure that you get your, as you get your eye test done every year, make sure you also have this important test done for those people who have blood pressure. Now, can you prevent blood pressure? Yes, definitely you can prevent blood pressure. And you can prevent blood pressure not by any fancy methods, by something very, very simple, right? First is reduce the amount of salt in your food. What does this mean? Reduce your salt means you, one pinch of salt is 1 gram. In a day, you have to take 5 pinches of salt. Now, in our normal food, we take 10 grams of salt in every meal. So you can imagine the excess amount of salt that we are consuming. Number two, eat fresh fruits and vegetables. And this is not only banana, but it has to be other fruits which are healthy. Number three, eat healthily and reduce your fats and fried food. Completely stop tobacco and reduce your alcohol. And finally, make sure that you exercise 30 minutes every day for at least 4 days in a week. This will go a very, very long way to reduce blood pressure. Now, how do you detect whether somebody has blood pressure or not? And the most important message I want to give you is that this is a silent killer. What do you mean by silent killer? Means blood pressure has no symptoms unless and until it has reached a stage where it is causing damage to the brain, damage to the eyes, which is at a very, very high level, right? A lot of people come to me and said, sir, your copa bala jaldi barta ide, our blood pressure ide. No, that is not the reason. Blood pressure has no symptoms. People are very important. I need you to know that the only way for you to know whether you have a blood pressure or not is to go to your doctor and get it checked, right? So now, one very important part is that most people, even if they have hypertension, their hypertension is not under control, right? So if you have an elevated blood pressure of more than or equal to 140/90, you need to take, first of course, lifestyle changes, second, medication, third is make sure you check your blood pressure regularly and have that altered, and finally you need to reduce your physical and mental stress, which means that make sure you exercise. Yoga and pranayama is very, very helpful, more helpful than medicine. Get a good night's sleep, which means that don't use your mobile phone in the bed. A lot of us reduce the amount of TV that you are watching in the evening. Go to bed early, wake up early. This is the natural rhythm for us, and that will help reduce your stress levels. It will help reduce your blood pressure. What about meditation? 5 minutes of meditation. When I say 5 minutes, which means spending 5 minutes to make sure that you're calm in the morning. Close your eyes. Simple 5 minutes of meditation helps people to reduce their blood pressure. Now, the most important aspect is know your number, right? Uh, why is this important? Because why is 140/90 important? Because multiple studies have shown that the higher your blood pressure is, the shorter your lifespan, right? It is very clear. Your blood pressure is low, you will live longer. Your blood pressure is high, your lifespan reduces. There is no doubt about it. Multiple scientific studies have very clearly told us your level of your blood pressure is directly related to how long you will live. So make sure that you know your number and make sure you work with your doctor. When I say doctor, I don't mean you go to your cardiologist if you have blood pressure. No. The best doctor for you is one who has time for you. Number two, a doctor who you can access, the person who is closest to you, the person who is your GP. That person is the right doctor to control your blood pressure. So do not at any point of time neglect it. Number two, 1 in 3 people have their blood pressure under control. Imagine that. Only 33% of people who have blood pressure have the blood pressure under control. So, again, each of us have to work very hard to make sure it is brought under control. And finally, one last important message that I would like to tell all of you is about low blood pressure. Okay. And a lot of people come and tell me, sir, nan low blood pressure ide, right? Now, I want to tell you that there is no such thing as low blood pressure per se. Um, if somebody had low blood pressure and I would pass a catheter like how I do an angiogram and check their blood pressure inside their heart, the blood pressure will be entirely normal. So, low blood pressure is not a disease. Okay. Those people are lucky because they will live longer. Low blood pressure is important only, for instance, if a person has low blood pressure and is entirely normal, you have nothing to worry about. Only, for instance, they have diarrhea, they have vomiting, they have blood loss, they have kidney or heart related problems. That is when, or stroke, that is when we need to worry about low blood pressure. So this is a few very important messages that I wanted to give you, and I'm going to pause now and open this up for discussion. There are a few questions that people have asked. I'll try and address them now. What time do we measure blood pressure during the day? Do we measure the same time every day? Um, Number two, is electronic BP a reliable device? So let me clear this up very quickly about a BP machine. Right, I have an Omron BP machine at home, and the reason is that it gives you fantastic convenience to check your blood pressure. It might not be 100% accurate as a doctor checking your blood pressure, but the level at which it is wrong is very small, right? The variance, as we call it, is less than 10%. So don't think that an electronic BP machine is not useful. It is fantastically useful. I think everybody should own one. Your blood pressure is always the lowest in the morning and highest in the evening. So while checking your blood pressure at home, I don't suggest to my patients, I want you to check your blood pressure every day until their blood pressure is brought under control. I would have them check maybe morning and evening and adjust their doses. Once their doses are adjusted well, you can record it once a week, once a month, but keep a close watch on it. You don't need to go to a doctor per se to check your blood pressure, but you don't need to go to the doctor with your diary with all your blood pressure readings so that your medicines can be adjusted. Now, how do you keep the heart healthy, and what are the initial signs of heart ill health? Well, there are multiple, and the most important ones are, of course, physical activity, right? If you walk normally or climb steps, you develop either breathing difficulty or chest discomfort. That is an important warning sign for you to get yourself checked up and make sure your blood pressure, blood sugar, all of these are under control. I think the focus should be not about signs of heart disease. The focus should be, can you control your blood pressure? Can you control your blood sugar? Can you control your cholesterol? Primary prevention, that is what we call it. Can you live a healthy life? That is very important. Can we drink one beer? Can we? What are the precautions after a stent? Now, uh, after a stent, you need to make sure, of course, that you are very compliant with your medication, and your doctor will then give you instructions and medication that you have to follow. And that is the two very important aspects. Make sure your medication is taken without missing a single dose. People after an angioplasty get into trouble because they stop their medication, right? Especially the blood thinners. Number two, make sure your risk factors, which is including blood pressure, blood sugar, are brought under control. So that is what we call secondary prevention. You've had a heart problem. After the heart problem you want to make sure that you don't get back into the hospital, right? There was one question about alcohol. Is alcohol recommended? The answer is no, at all, right? There is no beneficial effect of alcohol, may it be hard liquor, may it be beer, may it be wine. Let us be very clear that there is absolutely no advantage of alcohol in any way. Can we suggest diet to remove blocks? um, well, there was a very interesting theory that you can reverse a block with diet. And that was a doctor called Dr. Dean Ornish in the US in the 1980s. And multiple studies have shown that you cannot reverse heart disease once it is formed. But the focus of diet is to make sure that you don't develop heart disease, you don't develop blood pressure, you don't develop sugar and cholesterol. I think that is a very, very important message. All of these problems are of two reasons. One is genetic, your father has it, your mother has it, your brothers, sisters have it. Number two is lifestyle. You can't control your genetic factors, you can control your lifestyle. And if you control your lifestyle and do so very well, you will then prevent or at least delay any genetic problem, right? So that is something which is very, very important. If your BP is normal, can we reduce or stop your medication? The answer is no. You see, your blood pressure is brought under control because of medication. So what your doctor will do is that he will titrate the dose to bring it down slowly. You should never stop blood pressure medication. And thanks very much for this question, because what happens if you check your blood pressure at home? I've had so many patients who do this. They stop their medicine. Oh, my BP was fine. I don't need medication anymore, and they stop the medication. So what happens then, and what has happened, is the fact that your BP medicines were suppressing your blood pressure, keeping them under control. The minute you stop it, suddenly there's been a surge in blood pressure. They've developed a bleed in the brain, they've developed a stroke. That is not a place that you ever want to be. So don't ever stop your blood pressure medication. Work with your doctor to make sure that you continue your BP medication without stopping it. And what your doctor will do is to reduce your medicines at the appropriate time. Now, how do you differentiate chest pain from which is coming from the heart to one's coming from a gastric issue? um, Sometimes it is very hard, and this, if you have a doubt, please get an ECG done. Number two, get a troponin done. So these are two important blood tests that are done. There is another test, of course, Anand Labs was the first one to introduce this pretty much in India, which is called high sensitive troponin. High sensitive troponin is elevated and even mildly elevated if you are at risk, right? So it is not the red light, but it is the yellow light. Normal troponin, if it's elevated, it is the red light, and high sensitive troponin is like a yellow light. You need to be careful, because in the future you may develop a problem that is happening. Now, um, I have one stent. I would like to stop medications after lifestyle suggestions. I don't think I would do so, right? Of course I would make sure that my lifestyle is well under I would make sure my lifestyle is well under control and brought under control, which means diet, sleep, exercise, etc. Most people, if they don't require antiplatelet, which is aspirin and clopidogrel, studies have been found that if you take one baby aspirin, which is 75 milligrams, um, after the end of the first year of your angioplasty, instead of being on two antiplatelets, we put people on one antiplatelet, and that is lifelong. And it has been shown that those people who continue on that antiplatelet lifelong, and number two, those people are on a small dose of statins, it will definitely help them, right? Now, I've been advised clopidogrel on alternate days. Is it okay, or taking every day is better? Now, taking every day is better. But some people, for instance, have developed bleeding when they take clopidogrel. It could be in the gums, it could be in the skin, big blotches of redness that comes, and that is when we actually suggest sometimes that you take an alternate day, right? So that is a but the normal dose of clopidogrel is to be taken once a day, because that's how it works the best. How do you reduce triglycerides? Now, triglycerides is entirely food related, and you control your food, you control your fatty acids. I believe that it is very, very important to control your diet. There's a familial condition where triglycerides is very high. So what your doctor will do is, first they will control your LDL, which is your bad cholesterol. Once your LDL is under control, the next thing they will do is, can you increase your good cholesterol, which is HDL? So they'll try and increase your good cholesterol. Step number three is, then we shall be reduce your triglycerides. So it is done in a sequential, step by step fashion. Um, so what are the main causes of hypertension? And I've listed them out in my talk previously, and I will again stress on the lifestyle. How do you prevent heart attack? Stay healthy. The one good thing which I'm seeing, more and more people in the COVID times that they're doing is they're exercising more. They're walking more. They're wearing a mask and walking. They're making sure that they cook food at home. They don't eat outside. They reduce weight. All of these living healthier goes a very, very long way in making sure you don't develop a heart attack. You don't develop a heart problem. So primary prevention is a very, very important aspect. Now, here's a very specific question. I have a thyroid problem. I'm getting pain on my left side of the chest, and I have varicose problem. Is that heart related? Now, varicose veins has nothing related to the heart, and I want to stress that if you have varicose veins, it does not mean you have heart problems. So, if you have some symptoms of discomfort, come and get yourself tested, get an ECG, get an echo, and once you consult your doctor, they will advise whether you can do a treadmill, and that's how you screen whether you have a heart problem or not. Does calcium score test helps in identifying heart issues? Yes, definitely. Calcium scoring has been done for very many years. That is, they take a CT scan of the heart, and if there is more calcium in the blood vessels of the heart, uh, which is seen on the CT scan, it is a clear indicator that these people will have will have blockages inside their blood vessels. So calcium screening has been done. There's been a clear correlation between the screening for calcium and heart disease. Um, I Another question is that the one person has asked is that they develop bleeding when they take clopidogrel and they've reduced it to half. Now, clopidogrel and aspirin are two separate drugs, right? And they work hand in hand. And because they work hand in hand, they prevent the stent from getting blocked. Now, what you should do is reduce your aspirin, which is 150 milligrams of aspirin, down to 75. So, clopidogrel 75 and aspirin 75 is good enough. Then aspirin 150 milligrams. Uh, why is there a left hand pain inter- intermittently in hypertensive patients, but the ECG is normal? Now, an ECG tells us at that particular moment if there's somebody with a heart problem, right? It does not, if an ECG is normal, it does not mean that you don't have heart problem, and that is something that you should know. If you have severe chest pain and you take an ECG and that is normal, you know with 99.9% certainty, okay, this pain is not coming from the heart. But a normal person like you and me, if you take an ECG and it is entirely normal, it does not rule out a heart attack or heart disease. So you do need to get a treadmill done, you do need to get an echo done, and that is the one that will tell us with about 75 to 80% accuracy if you have any heart related issues. And that is the most important test. So ECG followed by echo followed by treadmill, these three tests in that order is important for you to know. I would like to know pH and systolic hypertension effective control. Now, both are very separate topics. So, blood pressure in the systemic circulation, which means the blood vessels that are supplying your whole heart, that is blood pressure. That is systemic hypertension. Pulmonary artery hypertension is exactly similar blood pressure, but that is only in the blood vessels that are going from the heart to the lungs and then coming back. So both have very different causes, both have very different impacts on the heart, and more importantly, the treatment is very, very different. All of us know about blood pressure, but lung to reduce lung pressure, you have multiple drugs. One is called bosentan and ambrisentan. The other one is Viagra or sildenafil. These are two drugs that we use to reduce blood pressure in the lungs. Now, we don't use that. They don't work for blood pressure in the rest of the body. And, like Amlong, Telma, etc., don't work on the lungs. So, both are very, very different. Does taking curd increase triglycerides? It's a very good question. I use curds every day. I don't believe so, right? But I'm not sure whether curds with whole milk and with a lot of cream, I'm sure that will increase triglycerides. I would suggest that you take the cream off before you have your curds. Is there a non-invasive test to know clots are leading to heart? Yes, there are multiple. And as I said, there's an ECG, there's an echo, there's treadmill. So these are things that you can do on a daily basis. Now there's also a fourth one, which is CT coronary angiogram, and in between both of them is a stress thallium. These are tests that you don't do very often. A CT angiogram, for instance, is a very, very good test to clearly tell us, is there a problem or there's no problem. The only difficulty in doing this test is radiation. Every time you take a CT scan, it's about 1,000 X-rays. And number two, you need to use a dye. And if you have a weak kidney, that may cause a problem for that. So that is a test that is not done, and your doctor will recommend when is the appropriate time to do that test. Primary prophylaxis with clopidogrel in a 65-year-old with genetic cardiac history. What is your advice? Now, primary prevention is very hard to say. If that person does have a strong family history of heart disease. When I say strong family history, I mean people have developed heart disease in young, less than 50 years old. I would definitely start them on one antiplatelet and one statin to make sure that they don't develop a problem. Is there a study that says that if you started early versus late, there's benefit? Yes, there's benefit in terms of plaque regression. The 4S study showed very clearly that earlier you start a statin, you prevent blockages from forming. So I would recommend for those people at a high risk definitely to be on these two drugs. um, Between aspirin and clopidogrel, I mean, there's no evidence with clopidogrel, but I'm going to assume it works pretty much in the same way. um, there's a doctor who says that he can remove blockages without putting stents by creating natural bypass. What is your advice? Well, there's been no known method, or let me put it this way: there's only two ways of you for you to remove blocks. Number one is angioplasty. Number two is bypass surgery. There is no third way of removing a block. Now, what does a natural bypass happen? Now, God has given us this ability that if there is a block, a natural bypass will develop by your body, uh, so that, say, for example, in in Infantry Road, they're digging, and but you need to go and visit Anand Labs. So what you do, you go from behind Infantry Road and come to Anand Labs. That is a bypass route that you take to reach Anand Labs. Exactly the same for the heart. If one portion of the heart is getting less blood supply, that ischemia, or the hunger of the heart to get blood, will release hormones and chemicals that new small blood vessels will grow and get blood from another blood vessel. So that is what you call collaterals. So which is why heart disease in older people, or a heart attack in older people versus a younger person, who is more likely to die? Somebody with a heart attack at the age of 65, or somebody at a heart attack at the age 45? Well, most of you will say, well, 65 or 75 will have a higher chance of dying than the 45-year-old, but the answer is wrong. It's the 45-year-old which has the higher chance of dying, only because as we grow older, and if the blocks are developing slower, natural collateral blood vessels will develop, which will prevent, or at least give a little bit of blood supply, and that prevents the heart from dying. So natural bypasses occur in the heart. There has been no way humanly possible where you can create this artificially. Very quickly, I'm going to what are the symptoms? So if any of you have any further questions, I'd be happy to take them. Please do type them out in the chat window over here, and or you can message Krishna to help in case you would like to speak up, and I'll quickly go through the chats in the meantime to answer any further questions. Um, Now, can tubular bronchiectasis with bronchial wall thickening be treated? Um, I really don't know. And as a cardiologist, though I can guess an answer, but I think the best person to answer this would be a pulmonologist. And perhaps they would be the right person to answer this. Um, now, uh, is chest pain always due to heart issues? Um, No, the answer is no. There are multiple non-cardiac reasons for chest pain, right? All of us, of course, know heart attack, but it could be musculoskeletal, which is the most likely reason. So if somebody comes to me with chest pain and they say there's pointing, oh, it is only here, I know the fact that, oh, it is musculoskeletal pain, right? Then there is pain from the lungs, which is called pleuritic pain. Again, it may come to you exactly as chest pain. Then there could be pain which is caused due to what we call pulmonary embolism, which is a clot that forms inside the lung, which can come exactly like a heart attack. There are multiple other reasons, pericarditis, which is an infection of the covering of the heart. All of these will mimic chest pain, right? So again, it goes back to how do you differentiate acidity versus a heart attack versus another cause. You should get an ECG, you should get an echo, and you should do a troponin T, right? These are very, very important basic tests. Do not neglect it. Most people neglect this thinking, it is only gas. That is not true. You cannot sit at home and differentiate this. You need to go and get yourself tested. Um, what are after angioplasty doing exercise or cycling yoga, is it okay? Absolutely, it's okay. Of course, it also determines is that how much is your cardiac function, right? Most people after angioplasty, I tell them within a month of their angioplasty, starting 1 week later, to start walking. And you need to start walking and slowly build up speed. By the end of the month, you should be walking 30 minutes a day. And when you're walking 30 minutes a day, your next objective is you need to slowly increase that to maybe an hour a day. And then finally increase the speed at which you should be walking. Now, a lot of people ask me, what is the speed at which you should walk? Now, and this is not related to this is not related to post angioplasty or post bypass surgery, but in general, walk. If you can talk and you can walk, that means you're not walking fast enough. Please remember that. So if you are able to, and you see so many people walking around, if you want a real cardiovascular workout, then you should walk to that speed where you cannot speak comfortably. So that is a very, very important. Cycling and yoga are definitely okay, no problem. I do not suggest my patients to lift weights. Once they reach a cardiovascular fitness for 1 year, that is when you add weights. Start off with 5 kgs and then 10 kgs. So aerobic activity is fine. Lifting weights is something that you should avoid. uh, can a person having reflux due to hiatus take aspirin? Aspirin will make the symptoms worse, definitely. But if you take aspirin along with ranitidine, Rantac, or Pantodac, or a proton pump inhibitor, I think you will be fine. The main problem with reflux is not the aspirin, but the fact that all of us will have a dinner and then go to sleep, right? And that is a very bad habit because the dinner is very late. If you can have your dinner by 7:30, go to sleep by 10, and all the food is gone below, that is the most important symptom, or that's the most effective treatment for this. So this is I'm going to wait for a few more minutes. Krishna, for any other questions that any of you have.
Sure, sir. In fact, I have posted my email ID. If any one of participant has any questions after this also, they can get in touch with me. I will try and get in touch with the doctor and get those answers.
Thanks. And though I don't work at Anand Labs, I have immense respect for the work that all of them do. I have an excellent friend of mine who was there, Dr. Ajit, one of the finest doctors who I have met. Any of you have any problems, please reach out to him. Again, he's a very, very unique clinician. He sees a patient and not the reports. There are very few such doctors who are there. Don't hesitate to reach out to him for any of your needs. He's available at Anand Labs.
Thank you so much, sir. Thank you so much for your kind words, sir.
Thank you all, and please be safe. Please remember that COVID is not over. Make sure that you wear a mask, and make sure that you walk. It is safe to walk with a mask. Make sure you maintain your distance, and take care of yourselves and your family. Thank you very much
Thank you.
to all of you. Have a wonderful day. Bye bye.